Hello, everyone, and good evening. I'm Luciano Nerd. I'm a consultant in reproductive medicine, gynecology, and infertility, practicing in Dubai, as well as in UK and Switzerland. I'm the co-founder and president of NOW-fertility, and I have the privilege tonight of standing here and hosting the second Fertility Connect event. The purpose of this event, like the previous one and any forthcoming ones, is to actually provide you with as much information as you need to make the right decision, to have all your questions answered, and to speak to a panel of experts that are joining me tonight openly, without judgment, and certainly in a very much friendly and independent setting. So I have a number of consultant colleagues joining me from NOW-fertility. I have Dr. Abu Musa, who is our Chief Medical Officer. I can also see Dr. Gripares, who is a consultant in reproductive medicine, our medical director for South Europe. And I have Claire Innes. She's a fertility and nutrition coach. I have Anna Pim, fertility acupuncturist. I have Julia Young, who is a PCO fertility nutritionist. Stephanie Toulemont just joined, fertility coach. Ian Stone, male fertility expert. And we had also Mel Johnson that had to drop out because of losing her voice during the course of the day. So we will have a very much open forum discussion, and it's not limited to the questions we have received in the last 7 days. So if you have any questions you'd like to ask to the panelists, please feel free to put them forward to us, and our panelists or myself will be glad to answer. I also like to remind our audience that Fertility Connect is not the only opportunity to ask questions or to seek professional advice. We have a monthly newsletter that is available on the NOW-fertility website. It's called Fertility Focus, and using our website, navigating the various pages of the website, you can see and find information about all the panelists, all the experts that populate the NOW-fertility network. So if you feel tonight not being the right forum, the right platform to ask questions, please go on to nowfertility.com website, and you may find under the resources page the contact details of the relevant panelist expert that you'd like to ask the question to. So we have around 15 questions have been put to us in the course of the last 7 days, but certainly, as I mentioned earlier on, if you have any questions, feel free to put them on the chat, and we will answer and collectively discuss in the course of the next 35 minutes. So I would like to start tonight with a very important topic that is asked every day to me as a consultant and to many patient forums by patients, and also requires a level of multidisciplinary input whenever we actually attempt to give an honest, transparent, and comprehensive answer. And this is about how to improve energy during an IVF cycle. And improving energy during the IVF cycle has got multiple components. Maybe clinical, be mitochondrial, maybe energy in terms of physical activity, maybe energy in terms of the ability to diversify what women and men embarking on fertility treatment do during the day. So actually not just focusing on the fertility treatment. So I would like to start asking Ian Stone. We give, for a change, the privilege to start the talk to a man, talking about male fertility. What is the advice you would give to men embarking on fertility treatment to improve the level of energy?
That's such a good question, isn't it? And I mean, I think really kind of it's probably a lot of advice that people will hear, all over the place around improving energy. It's about good routines, it's about good nutrition, it's about good hydration, and it's about good sleep. I think, but actually also importantly for men is exercise and the right exercise. We know that actually, if you're exercising some of the big muscle groups like the thighs and the back muscles, that can help improve testosterone levels. And I see we've got Maria, fertility fitness coach, busy spooning stuff in. She'll be able to kind of reassure on this. But I think, it's in this fast-paced life where, we're bombarded by, social media, artificial light, artificial heat. It's very easy for us to lose our natural rhythms that our body wants to kind of adhere to. And I think if we can
Ian, I
stick.
think we lost you. The volume is
Have you got
gone.
me now? How's that? Is that better? Hang on, let me
Yeah,
try.
you're back. You're back on.
How's that? Is that better?
Yeah, better. Thank you.
Good. Okay, I'll go without the headphones. So yes, I was saying that, like, I think we need to stick to our natural routines, natural rhythms. With artificial light, stimulation from phones and devices, it's all too easy to binge watch something on Netflix, stay up late, then sleep in at the weekends, eat rubbish food, and the knock-on effect is absolutely massive. So I think if we're trying to manage our energy, sticking to those regular routines, regular nutrition, sleeping well, hydrating well, exercising regularly. Like today is one of the major first sunny days we've had in the UK, like this year. Like getting out and getting light, getting fresh air, all of these things will really, really help. I think personally, for me, the key to good energy is good sleep and sticking to good routines.
Thank you, Ian. Hannah, do you believe that acupuncture can help improving energy in men and women?
Again, it's a good question. I mean, as an acupuncturist, we are working with the body's energy, and a lot of the time we're trying to boost people's energy. But it really, really depends what's going on underneath that, because as an acupuncturist, obviously we concentrate on acupuncture, but we also want to make sure we're ruling out any underlying issue for low energy, whether that's an emotional issue or whether there's a problem with thyroid, whether there's a problem with iron. So we always need to make sure that the physiological effects of energy are being investigated. But acupuncture is all about strengthening energy and boosting energy. So yeah, it's always what we try and do when people come in and say they have low energy.
And Claire, how can mentoring and coaching women improve their energy during and after perhaps a fertility treatment cycle?
So, in terms of energy during IVF, I always like to talk about the actual energy equation, energy in versus energy out. Just keep it really basic. So, I would always say make sure that when you're going through IVF, you're having plenty of healthy fats. IVF is a marathon for the ovaries, it's not a sprint. So steady energy from things like eggs, avocados, and nuts instead of that kind of sugar roller coaster. And then, as Ian said as well, hydration is non-negotiable when going through treatment. Hormonal shifts can make you feel really sluggish, really bloated. So 2 to 3 liters of water with a pinch of sea salt should really, really help as well. And then, I mean, personally, I'm a bodybuilder. I like to lift with weights, and I train my clients on that side of things and muscle growth. I don't have any issues with my clients
Again,
doing their
Claire, I
normal
think
exercise
you've
routine.
gone silent. Sorry.
Can you hear me? Thank you, Stephanie. So when my clients are stimulating,
Still,
I'm
we
fine
cannot
with
hear you,
them.
Claire.
Is it maybe you, Luciano?
Yeah, we can hear you.
I can hear
Okay,
you.
We can hear you.
sorry.
It's
Then
you,
it was me
Luciano.
probably. Yeah, I don't know what. Sorry.
Sorry. So yeah, when stimulating, if my clients are feeling fine, I'm fine with them doing the normal amount of exercise, but in their 2 week wait, I normally prefer kind of more gentle exercise. So when they're expending energy, nice walks, restorative yoga, just keeping it nice and chill. And then possibly even some magnesium before bed, just to make sure that they're actually getting that restorative sleep as opposed to just token sleep.
Thank you, Claire. And Tony, does energy enhancement make a difference to IVF cycles?
Well, I think when we're talking about energy, talking about here energy enhancement, and so far everybody talked about different lifestyles that will keep us energetic and will help the patients in going through this long journey. I think yes, it helps. Now, if you want to talk at the molecular level, there has been some supplements that might be of use in such patients. We're talking about energies related to both eggs and sperms, how can improve the energetic quality of the sperm and the eggs. There has been some studies on NMN that might be of useful, especially when it comes to the mitochondria of both sperms and eggs. Of course, these studies are just prelim studies. We need more evidence to support that. But more and more research and papers are coming out that such supplements might be useful in improving the quality of the eggs and sperms through improving the mitochondria function and therefore the energy of such gametes.
Thank you. One of the questions that just been asked to us just now is, do peptides help to improve energy? I will just answer this question. There is growing evidence that peptides can help. So peptides are small chains of amino acids that are important to populate proteins and the signaling, particularly when the signal is important to convey an hormonal message or an energy message or for DNA repair. There are some specific peptides that have been shown to have a potential benefit. And we know that peptides are used for longevity, for fat loss, for immunity, to improve sexual performance, as well as for energy. And some athletes have been using peptides in the past. And amongst those, we have the CJC as a peptide, we have ipamorelin, we have epitalon, that can all have a potential benefit in increasing levels of energy. Whether these are going to make a positive impact to the IVF cycle remains to be established. But clearly, there is growing evidence that some of the peptides administered at the right dose and certainly to the right patient population may be of benefit. Thank you. So we move on to the next question, and this is related to intermittent fasting and PCOS. So I will start asking the question straight to Julia. How does intermittent fasting improve PCOS symptoms, perhaps also related to the fertility aspect of women trying to conceive and known to have either polycystic ovaries or polycystic ovary syndrome?
Sure. So I think it's really important to make a point that everyone responds differently to it. So it's not necessarily a useful tool for everyone. And for people that don't know that much about fasting, there's different types. You've got your sort of alternate day fasting. There's a 5-2 diet, which was popular quite a long time ago, where you'd fast for 2 days and then feast, I suppose, for 5 days. And the most common is the time restricted eating, where you would restrict your eating window to a certain amount of time. So it could be 12 hours, 10 hours, 8 hours, etc. I think there are definitely benefits for PCOS, in the main one being that it can alter insulin sensitivity. And we know around 70% of women, the root cause of PCOS is insulin resistance. So it can really help with that. It can also help with reducing overall caloric intake and therefore helping with weight loss. improving things like acne, unwanted hair growth. So many of the symptoms of PCOS can be really helpful, and also lowering excess androgen production as well. So women with a sort of central adiposity or chronic inflammation, I think PCOS can play, fasting can play a really important role. But I think it's important to note that it's not necessarily a great tool for everyone, particularly if there's this lean PCOS, and potentially weight loss is not something that people need to achieve, or for highly stressed women, because it can increase our cortisol levels, and that's not something we want to be doing, particularly around in PCOS or infertility as well. So generally the way I would work is I would advise it's something potentially a useful tool to be doing maybe before you're starting to conceive, but once you're going into actually trying to conceive, it's not something I would recommend for long periods of fasting. Definitely maybe a 12-hour sort of overnight fast can be really helpful. And in particular, maybe having an earlier dinner, and then rather than going for a sort of later dinner and then skipping breakfast or things like that. So there's, we don't want to necessarily be skipping meals, because then we're losing out on nutrients, which could be really helpful for fertility. So it's something we just need to, I think, assess on an individual basis. Is it right for you? Obviously something that can definitely be tried out and see how it works. And many of the benefits of fasting can be achieved through just balanced meals, adequate protein, regular eating patterns, resistant training, all that sort of thing. So there's definitely it's not a black and white answer. Is it a good thing or not? I think there's potential in there, but just be careful around when actually trying to conceive, is my opinion.
Thank you very much, Julia. This is actually very interesting. I will come back to you with something linked to this, but I believe that a well-balanced diet, probably protein richer than normal during a fertility treatment cycle, is of paramount importance to enhance ovarian performance, cell function, and maintain a good positive emotional status. Claire, what do you think about intermittent fasting as a nutritionist?
So intermittent fasting, the most common way I see people doing it is they call it intermittent fasting, but they're basically skipping breakfast. And in those cases, I am not a fan at all. So as we know, most cases of PCOS come about due to insulin resistance. One of the very common side effects of insulin resistance is obesity. And it's very normal, very logical for someone to think, okay, I'll try skipping breakfast to create a calorie deficit, or I've got PCOS, I've heard that intermittent fasting is a good idea. But in real life, what often happens if people do this unsupervised is that they skip breakfast, they are really, really hungry by the time they get to lunchtime, and then they use the gap between lunch and dinner to snack on things, and they might snack more after their evening meal as well. So essentially they're taking away this opportunity in the morning to have the proteins, the fats, the things that they really need to set themselves up for, a good day. And instead, those calories are getting redirected to things like, nibbling on cookies off of someone's desk. Often they don't even know they're doing it. So intermittent fasting, when supervised, and I couldn't agree more with Julia, if I recommend it, I prefer a 12-hour overnight fast. Not a fan at all of skipping breakfast, though. It's not useful.
Thank you, Claire. Julia, I want to get back to you with perhaps a little bit of a controversial topic, which is about the use of GLP-1 receptor agonists, such as Ozempic or Mounjaro or Wegovy. How do you think this impact the potential of a woman, irrespective of age, to embark on fertility treatment?
Yeah, I think a really interesting one, and we could talk about this for a long time, but I think they're becoming obviously very popular, and they're something that are continuing to grow. So it's something we definitely have to keep an eye out. I think there's pros and cons to them, and I certainly don't judge anyone taking them. I think it's really important. There's a really important role for nutrition in supporting these medications, because obviously appetite is reduced. So we have to make sure that people are really optimizing the nutrients they're taking in when they're on these medications. My slight concern, so I think it's great if there's weight to be lost, and we know all the improved benefits of being a lower weight for trying to conceive, or being a healthy weight, for trying to conceive. There's vast benefits in that, and when we're pregnant, being a healthy weight is really important as well. So I think there are some real benefits to them. My concerns are around things like bone health. So we know there's some research that they can impact bone health. So again, we need to be making sure we're getting all the nutrients to support that. Muscle loss, so again, optimizing protein intake is going to be really important. And some people have had impacts on gastrointestinal effects and nausea, and some gastro symptoms as well. So I think they need to be, something to keep an eye on. I believe from the research that they're not safe in pregnancy. So there's a period of time that people should stop taking them before actually getting pregnant. And I think fertility aside, I think probably one of the biggest risks is when people come off them, because invariably people don't want to be on these medications ideally for the rest of their life. There is the problem of the weight gain as well. When your natural GLP-1s has been suppressed, and then the hunger can come back quite strong. So managing that through nutrition is really important. So there's definitely a place for them, and I think it's just going to grow, but it's being able to manage it properly, I think.
Thank you. Again, I think we covered a very interesting and to some extent hot topic when it comes to fertility, weight loss, polycystic ovaries syndrome. I sincerely hope that the information we shared and your experience will be of benefit to the audience. I would like to move on to another important topic, one that actually I know is probably one of the main limitations when it comes to the ability that patients have to embark on subsequent cycles of IVF and generally fertility treatment. And that relates to the emotional impact that failed cycles, or emotional impact that unsuccessful fertility treatments, and in some cases also the emotional impact just starting a treatment may have on both women, men, and certainly couples. I would like to ask Stephanie, as a fertility coach, what is the advice you give to patients to keep mentally well, to cope with the stress, the anxiety, and the pressure of fertility treatment?
Wide question. I think there are many different answers. The first one would be that what I always recommend to the patients is not to be disconnected from their emotions, because very often we have this physical, medical part of the treatments, and then we cut ourselves from our emotions. And I think that accepting our emotions, identifying what we are going through, and understanding that this emotional load is normal in fertility treatments, that we are normal. Now, lots of people ask me, am I normal to react like that? Am I normal to be so emotional? Yes, it's a very emotional project. And we are filled with contradictory emotions of fear and hope, of happiness and anger, of sadness, and lots of things. So I think the first thing is this, not to accept the emotions, maybe work on it, write a little bit every day about how we feel. I think it's a good way of connecting with our emotions and try to understand this emotional load. And then, and I think it's related also with the energy, to keep doing projects, keep doing things for yourselves, not focus 100% or 150% on the fertility treatments. Lots of people put their life between parentheses during the treatments, and we don't know. There are many things that we don't control in fertility treatments, and the physical and medical part of it we don't control as patients. What we do control is what we do with our lives and how we talk about to others about our issues. So I think that keep having personal projects, keep doing things for yourself. Do not focus only on these projects, and have projects, professional, personal, anything. Do things that you like, that you enjoy, and that help you feel well and relaxed.
Thank you, Stephanie. And Ian, from the male side, what do you think can make a difference, or a positive, a real, significant difference to a man when it comes to supporting his wife or coping with his own emotions?
Yeah, it's interesting because men often carry a huge burden around infertility, but they carry it silently because it's kind of an innate thing within a man. And this is not kind of a, a slightly stereotypical thing, I suppose, but us men are kind of fixers. We want everything to be okay. If we see our partner going through difficulties, we want to try and fix that. And one of the ways that a man will do that is they'll squash down their emotions. They'll just say everything's okay. They won't talk about it, and they'll just try and soldier on. And in all honesty, whether it's fertility or anything else, it's one of the worst things anybody can do in terms of just squashing it down and saying, I'm okay. And I think what tends to happen is the woman then gets increasingly frustrated because the guy is not talking. She knows he's not well. She knows he's struggling mentally, emotionally, but he's not talking about it. So I think one of the best things, a man or any couple can do is first of all talk to each other, and that can be hard. It can be really, really hard. One of the things I've always advocated is go out for a walk so you're not sitting face to face, go out for a drive, so you're not face to face, and be honest about what's going on. And I think for most men, when they open up and start talking, they realize that actually it's really, really helpful. And for men, we kind of access support differently. It might be they need to go and listen to a podcast. It might be they need to find that one guy in their friendship group who will truly listen and understand. It might be they need to go to an acupuncturist or a nutritionist or a coach. It might be reflexology. It might just be a sports outlet, whatever it is. I would say a sports outlet. I don't mean a shop. I mean, going and playing football with their mates or whatever it is. So there's lots of different ways. We have a monthly support group for men, and actually, when they come and they open up and they talk, it makes a massive difference. And it may be going to see a fertility counsellor. I think the takeaway for men has got to be it's okay. It's all right to open up and talk. Just find that route that works for you, and it is different for everybody. But be open.
Thank you, Ian. I very much believe there's no one size fits all in medicine, and certainly there's no one size fits all in the fertility care, infertility care. And I want to know from Hannah, which kind of men and women population would be the most to benefit from acupuncture in order to help with the feelings, the emotions, the general well-being?
I mean, as an acupuncturist, I would say everybody would benefit from acupuncture, but I think it works particularly well if you are feeling very stressed and you're feeling like things are out of your control, because it's very difficult to tell a person to not be stressed or to relax or to sleep better. And sometimes people know that they need to do that, but because they've got this anxiety loop going on and all these thoughts and their minds are very busy, they find it very, very difficult to switch off and actually find that place of rest and digest. And acupuncture is magic for putting people back into that state. So out of that stress cycle into that kind of rest cycle, it's absolutely brilliant. So people who really suffer with issues around sleeping, people with busy minds, people who literally say they feel the stress in their body, or when they're stressed, it goes to their digestion, or they get headaches. Those people who respond in a very physical way to feeling stressed do really, really well in clinic. And I think people who want to have some control, because that, IVF and a fertility journey, lots of things feel out of your control. So coming in, having a weekly treatment and time for yourself to talk to somebody, to have somebody listen, to have somebody validate how you feel, and then to have a treatment that actually relaxes you and de-stresses you. So you leave feeling lighter and a bit more in control and a bit more like I've done something to help with my stress. I think that those kind of people respond really, really well to treatment.
I absolutely agree. Thank you, Anna. Moving on to the next question, and I would like to ask Tony, what do you think is the benefit and the drawback of dual stimulation?
Dual stimulation is usually what it means. Actually, it means that doing 2 ovarian stimulation in one menstrual cycle, which means that a patient that are usually started ovarian stimulation from day 2 or 3, and they finish within 2 weeks with the pickup, they rest for 3-4 days, and then we re-stimulate the ovaries again for another cycle of pickup. So within 1 month, the patients will undergo 2 pickups. And this is usually done mostly in patients who are having cancers and they're going to go through chemotherapy, and there's no time for them to lose. We want to pick up as much eggs as possible so that we can create as much embryos as possible in the future. Now, the advantage of this is, of course, as I said, is having a lot of eggs in 1 month. Used mainly in cancer patients, can also be used in patients with low ovarian reserve, so that we can collect as many eggs as possible. Patients with advanced stage is also useful, but it's not the standard of care for all patients. Usually we'd like to have the patient rest. Most of the time we advise 1 month rest between one cycle and the other. Now, the question is whether the eggs that are obtained in the luteal phase, which is the second part of stimulation, are as good as the eggs that are collected in the regular stimulation, which starts on day 2 or 3 of the cycle. Most studies have shown that these eggs are quite good as eggs obtained in the first part of the stimulation. They give good eggs, they give good quality embryos, and the success rate from these embryos obtained in the second part of stimulation is also good. Now, the drawback of such stimulation, of course, is the cost. The patient will be paying more money for stimulation and pickup. We're talking about the stress and the emotional impact on patients. Also, this is quite a stressful procedure, having 2 IVFs in 1 month. And probably the outcome of these eggs, because most of these patients, as I said, might have low ovarian reserves, at the end of the day, the desired outcome of the quality of eggs and the number of embryos needed might not be as promised to the patients.
Thank you very much, Tony. Thanks, very helpful. We have still 10 minutes to go, and we have some very interesting questions being asked by our audience in the last 7 days. One of these is actually, are frozen eggs less viable the longer they are stored for? And I think this is a question that we can all answer, but I will ask Dr. Gripares to give us his opinion as a fertility specialist, whether there is enough reassurance we can give to patients not to be concerned about how long they're freezing the eggs for.
Hi. So today eggs are frozen with a technique called vitrification, which is an ultra-rapid freezing method that prevents ice crystal formation within the cell itself. So after vitrification, the egg is metabolically inactive. The DNA inside does not age any further, and all cellular processes stop. So at this moment, we know that an egg frozen for 1 year and one egg that is frozen for 10 years have the same biological potential, assuming that the storage conditions are stable. So basically, the eggs that are frozen with the current methods are of same quality, no matter how long they are stored for.
Thank you. Thank you, Ioannis. Ian, going back to the male side of our fertility daily work. One question that we have received, and actually one that is very interesting, is how accurate is a semen analysis, not just to predict fertility potential, but to make a man think whether he should be freezing sperm because his fertility may be going down the track line.
Yeah, this was a really interesting question. I think first of all, I think it was oh no, the name's just escaped me. But the quote is that a semen analysis has no more predictive value today than it had when it was, first, used many, many years ago. It is not a good predictor of fertility outcomes. It's a good initial screening tool to see how many sperm a man has, how well they're swimming, and what shape they are, but it doesn't give you predictive live birth outcomes. And the question was, should a man then freeze his sperm if his semen analysis is suboptimal? And I can only think that this has perhaps come from the kind of media hype around women freezing their eggs. Because it's kind of like allows you to take a snapshot in time and kind of protect where you are, because as we know, for women, egg reserve and egg quality deteriorates with age. Now, this is not the same for men. Yes, there is a decline in testosterone levels and therefore some sperm quality with age, but men produce sperm the entirety of their life. So I would look at this another way. If a man has got a suboptimal semen analysis and he's asking himself, well, should I freeze this sperm now before it gets any worse? Or is this as good as it gets? Let's freeze it before I get older. I don't think that's the way to look at it. I think the way we need to look at this is I've got a suboptimal semen analysis. What's going on that might be causing that? Because we can do a massive amount to turn sperm health around very, very quickly. It takes 74 days to it takes 74 days to produce sperm, and therefore we can turn sperm quality around in perhaps 3 to 6 months. So if a guy's got a suboptimal semen analysis, we've got to be looking at lifestyle, we've got to be looking at the diet, we've got to be looking at the work environment, environmental pollutions, medication, infection, varicocele, all of these other factors that could be impacting his sperm quality. And that perhaps needs to be overseen by a male fertility expert, such as a urologist, andrologist. And once you've done all of those factors, you then repeat your semen analysis and see if it's improved. And it might then be, there are definite reasons to store sperm, but if it's only because of a suboptimal semen analysis, I'd say you need to dig a little bit deeper first and try and find out why that's happening, rather than just storing it thinking, okay, that's all I've got. And that's, it's not that's where it is and it stays there. There are other things that can be done.
Absolutely agree. So freezing sperm, just to perhaps shorten that point, freezing sperm is not the solution to the suboptimal sperm analysis. The first thing is to investigate why, to ensure that there is a way to turn that around, and perhaps trying to turn that around and consider freezing when there is a better potential for the sperm. And that actually is linked to the next question being asked by our audience as well. How can we improve sperm parameters, especially sperm quality, if a man with non-obstructive exospermia is going to be undergoing surgical sperm retrieval? But I think actually we should be perhaps more open than just surgical sperm retrieval. Is, can we, Claire, improve sperm parameters just based on diet when there are not other confounding factors?
Did you direct that to me or to Claire?
Claire.
Apologies. So, as you know, I only work with women, so I concentrate on egg health, but a lot of the kind of interventions and the things that we would suggest are exactly the same. So while it's 74 days, did you say, Ian, to produce sperm, it's 90 to 100 for women. And I always recommend looking at this as the kind of the four pillars. So what we're eating, our exposure to dangerous and harmful chemicals that might be having an effect on our fertility, and the actual environment that the eggs are growing in. So looking at things like inflammation, gut health, are they in an optimal environment to grow and go through that chromosomal sorting period without any errors?
There is a growing evidence, certainly amongst the female population, that taking anti-inflammatories and taking antioxidants has a significant improvement on egg quality. So what is your recommendation then, Ian, for a man in terms of best diet? Of course, we know what is the best lifestyle change, but what is the recommendation in terms of best diet and best supplements to take in order to improve sperm parameters?
Yeah, very good question. And it's one that comes up time and time again, does diet and lifestyle for sperm health? And the question, like you said, we've broadened this out to every man, but the question I think was about non-obstructive azoospermia. And really, whatever we apply to any man to improve his sperm quality also applies for a man with non-obstructive azoospermia. If he's got any sperm in the testicles at all, then improving that environment as best as he can will help that sperm. In terms of research, I think one of the best things that has shown to help sperm quality is a Mediterranean style diet, which is lots of fish, lots of good quality meat, lots of vegetables, lots of water, hydration. I'd imagine the sunshine probably helps in a Mediterranean style diet as well if you're kind of overseas and getting some vitamin D, omega-3s. All of these things give us really good foundations for sperm health. And then the question about supplements is a really, really interesting one, because men will think, okay, right, if I'm taking this antioxidant, if I take twice as many, it'll be twice as good. If I take 4 times as many, I'm going to have 4 times as many sperm. With blokes seem to have this concept of more is better. If it can go up to volume 11, I'll have that one rather than volume 10, This is not the way to approach sperm health. Definitely, we want to look at things like vitamin D and omega-3 supplementation, especially in the winter for men. And there are some other kind of broad supplements, maybe like vitamin C, that would be helpful. But if you're going to look at things like antioxidants, which are very well indicated, but only in certain circumstances, the key is that a man ideally needs to be tested to see if he's got oxidative stress going on within his seminal plasma. When you've got oxidative stress present, antioxidants will work very, very well. If you haven't got oxidative stress going on in your seminal plasma, antioxidants can be detrimental to sperm health because they push you into what's known as reductive stress. So you can have what seems like too much of a good thing. So I think the important thing for a man is actually really to get tested and find out what's going on, have a Mediterranean style diet, do all of the right things in that sense. If things still aren't improving, go and have the right tests, and then decide whether you need to have supplements or not. My only caveat for that would probably be if there's a guy that has got, clear nutritional deficiencies, is maybe doing shift work, has a real aversion to vegetables, and it isn't getting a good amount of antioxidants in his diet, then a good all-round antioxidant will probably not do any harm, but more is not better.
Thank you very much, Ian. Stephanie, how do you persuade or how do you guide or coach men and women when it comes to changing the lifestyle to improve egg quality and sperm quality?
I'm not sure I can answer that question because my coaching is more of an emotional coaching rather than improving the quality of gametes.
When it comes to the emotional side, there are men and women that while undergoing fertility treatment or prior to fertility treatment, they may not be in the right place emotionally, which brings them to not give up on the bad habits they may have. And
Okay.
at this point in time, actually, I'm reading a book I would recommend to everyone. It's called Atomic Habits, and shows how 1% of changes we make to our life every day is going to result in a 12-month period to about 37% changes that we actually make. But you have to be consistent. You cannot just have a good habit 1 day a week, or do it for 1 week and expect the following week you lost weight. It's the same. So from a fertility coaching perspective, how do you help men and women to change their mindset or to support themselves so that they can make some significant changes to their lifestyle?
I think, as you said, no, in the end, the emotional load and the stress, what they have is an impact on our behavior and thus on our health and fertility health. So yes, I think it's a very personalized approach, trying to invite them to find the right habits. Now, we talked about routine before, and I think that having a healthy routine, a simple one, a very simple one, focusing on 1 or 2 things that really help you to relax and to deal with this stress. So that would be, yes, like trying to implement a simple habit, something that you feel comfortable with, you know that helps. And this is very personal. So usually coaching is really about helping the person to find his or her own resources and his or her own strategy.
Thank you. And we have two last questions in offering 3 minutes. One is a question that I can answer very easily by reading the recommendation given by Mel Johnson, solo parenthood coach. And the question is, are there any books that we can recommend for talking to a donor-conceived child? And Mel suggested 3 books. One is Lily's Blueprint, where there are different scenarios that can be shared with a donor-conceived child. The other one is Happy Together. Again, is a cartoon-based book covering a range of scenarios that can be discussed and presented to a donor-conceived child. And the third, certainly one I know very well, is the one published by the Donor Conception Network, is Our Story, every different type of donor conception scenario, going from sperm to eggs. And I think this is certainly a very good platform to discuss the certainly difficult topic of how a child was conceived with the child. But now I have one final question, which I think is very important, and I would like to have perhaps 10, 15 seconds from everyone. This is what do we think is going to be out of date in terms of fertility care, fertility treatment in the next 10 years. So I think perhaps we can have a round of comment just for 10, 15 seconds. We'll start with you, Ian. What do you think is going to be out of date in the fertility, male fertility practice within the next 10 years?
I knew you were going to ask me.
Don't say men.
Well, potentially, actually. You know what? You're going to have to come back to me, Luciano. I knew you were going to come to me first. I'm going to think on that. Come back to me.
Okay, then Tony, what do you think is going to be out of date in the next 10 years?
I think the way we are stimulating our patients is going to change. It's going to be more personalized. Now, many centers, they use standard one-size-fits-all for patient. I think this will be outdated in the future. But what I see is coming in the probably 5 to 10 years is AI will be dominating our field. It will help us to choose better gametes, better embryos, probably better implantation and better pregnancy rate. And what I also think might happen is that we'll be start making some gametes in vitro from stem cells, sperms and eggs. Probably this will be coming, don't know when, but it will be coming.
Making some what, Tony?
Sperms and eggs in the lab from stem cells or somatic cells, like skin cell, changing it to a sperm or an egg. So you don't need men, you don't need woman, you need any stem cell.
Thank you. So, Julia, what do you think is going to be outdated in the next 10 years in the fertility sector?
I hope in terms of nutrition, it will be sort of generic diet advice, generic supplements, and also similar to what Tony said, moving to a more personalized approach. I think I'm hoping that people will see that just routinely taking whatever supplements they think are good and eating whatever they read online they'll realize that's not quite effective and they'll be looking for more personalized support. And in terms of the focus, so yes, more personalization. Potentially, there already is quite a bit of focus, but more focus on nutrigenomics. So looking at individual genes and how they respond differently to food and nutrients. I think that's going to be an area that's going to grow even more, and that will be, again, personalization is going to be really important in that area.
Thank you. And Hannah?
Maybe there will be less direct pathways to IVF, because I think sometimes it feels like a fertility problem and this is like an NHS pathway sometimes, is a lot around straight to IVF and a lack of research and investigation and diagnosis into what the actual fertility problem is. So I guess it's that those unexplained infertility couples that you see in IVF clinics that don't get the results that they want. I hope that there will be less of those because we've got better diagnostic tools and we're looking at the couple as opposed to the female and thinking about why is this couple sitting in front of us not able to conceive.
Claire?
100% BMI and isolation. I hope that is gone in the next 5 to 10 years. I hope that is gone yesterday. BMI alone doesn't measure body fat. It doesn't measure hormone health.
And Johannes?
Well, everyone had valid opinions. I'm going to talk more scientifically. I'm sure that the embryo grading system under the microscope will change with all the artificial intelligence coming into our life. I believe that embryos will be assessed by AI. Also, PGTA might change. And I really hope that we will be able to offer older patients better outcomes by improving the way the mitochondria work, either with some changes, dietary changes, or whatever it takes, or by replacing the mitochondria.
Okay, thank you. Ian, back to you.
I've come up with loads now.
Okay, 10 seconds.
10 seconds. The first thing, in 10 years, it would be nice if we weren't referring men to gynecologists for fertility issues, that actually, kind of what Hannah said, we have a clear pathway where men are referred to a male fertility expert as women are referred to a female expert. So that happens in unison. And then the other one is in 10 years' time, I hope no man's production room has dog-eared magazines with pages stuck together, because that is still happening to this day. So there we go.
Yeah.
Luciano, what about you?
Actually, I think within the next 10 years, the standard IVF clinic as it is now will be outdated. There will not be any more IVF clinics with a big laboratories, with a big team of embryologists. I think that overall, definitely in my lifetime and my professional time, I will see some significant changes in the fertility clinic and setup of fertility clinics, this being much smaller and probably more open spaces with embryologists working together with technology and perhaps new roles, responsibilities and professional component within the fertility clinic actually be becoming part of routine standard care. And I always say that, and I was just having a conversation today with actually one of my colleagues, that if we are afraid of losing job or losing our job because of technology or AI, then be prepared to actually not have a job if you don't embrace innovation in technology. So we have to be open-minded, and the fertility clinic, the fertility setup, the IVF laboratory is definitely going to change probably in less than 10 years. So I think we have had another great evening, and personally, I'm the first one to enjoy this kind of multidisciplinary open discussions. Like last month, again this month, I very much enjoyed and learned from all of you. And I find so stimulating having a different audience of patients or members of the public asking questions that make me think as well outside the box sometimes. So thank you very much. Thanks for bringing tonight your expertise, your knowledge, and putting this to the benefit of our patient population. So we will reconnect for the next Fertility Connect in March, and you will be soon invited by our coordinator Annette, that is certainly very central to organizing this event and making sure that we are all standing here and share our knowledge and time. So just for that, thank you once again on behalf of NOW-fertility and everyone else, and have a very, very pleasant rest of the afternoon, evening, or night, wherever you are.